Welcome to the number one spot health and wellness practitioners go to double their current income and turn their 10-hour work day into a 10-hour work week. Join us as we dive into the tips, tools, and tech you need to create a life and practice on your own terms. More freedom, flexibility, fulfillment, and of course, funds. It's time to build your online practice. And I'm your host, Michelle Rogers, also known as the WELLthy Woman. Be sure to subscribe for your weekly dose of education, inspiration, and action. Let's get started. So we're going to be talking about a continuous glucose monitor today, which I'm very, very excited about. The company is Veri, and this is Hana. And so the talk is glucose monitoring for metabolic health. Now, Veri is a CGM-enabled, CGM means continuous glucose monitor, CGM-enabled platform that helps practitioners and their clients find the specific foods and habits that improve their metabolic health. Hana leads B2B business at Veri, working closely with the engineering team to build the tools our partners use every day. PCOS and pre-diabetic diagnoses as a teenager fostered a lifelong passion for wellness and human-centered design that has fueled her work at Veri, Fitbit, and Belkin. So good. I am so excited. So I have a question that I have been asking all of the speakers. So I'm going to put you on the spot. Are you ready for it?
Let's go.
So as an expert in the field, how do you anticipate the online space evolving for health practitioners, for health and wellness practitioners? What shifts or trends do you believe are going to shape the industry in the near future?
Ooh, I love this question. And it's a big question. I think we're already seeing it starting to take shape. I think even over the past, 5 years or so, and especially during COVID, just the rise of access, I think, digitally, where we can have these virtual sessions with each other and learn things and be able to monitor things without physically being next to each other, which, there's always a trade-off. I think we're still working through how to actually do this holistically. So I think it's the Wild West and we're all still learning. But it really excites me that we're able to create access in different ways, whether it's how quickly can you see a practitioner, what types of practitioners are available to you. Maybe they're not in the same city as you. So typically you wouldn't be able to see that practitioner, but now via virtual health, you're able to, and also price. So there's different ways that I think this creates access for people. And I feel like I've been the beneficiary of that in many ways. So much of my healthcare and wellness is now done virtually, which just kind of amazes me. But I'm really grateful for it. So I think there's still a long ways to go. But I love that we get to help define that and co-create that and create, the world that we want to see in the future.
Yes, I love that you said co-create because it's so true. It's like I keep telling practitioners, I'm like, we're the early adopters, like we're the pioneers. Like it is still totally the Wild West, and we get to really like shape where we're going in the direction and like how this is all unfolding. And it's a really, really exciting time to be in the online space, and like companies like Veri coming out and being like, wait, what? You can help me like optimize my client and patient care like virtually? Like, wait, what? So just so excited to have you here. I think you have a presentation, but do you want to just like talk about Veri, talk about like how continuous glucose monitor can help with client outcomes and like how practitioners can really start to implement something like this into their practice to really give them some ideas and get those wheels turning?
Absolutely. And I only brought slides today because I think so much of what we're talking about, I'm a very visual person. So I always just bring visuals with me. I think it helps. So I'll be speaking to them. Happy to send out these slides afterwards. And we also have created a special page just for attendees today that's going to have kind of details of everything we went over. So don't feel like you have to like write notes down for everything. I know we're going to go through probably a lot. Yes, Veri is the name of the company. Thank you, Michelle, for putting that in the chat. And before we like jump in, I would love to know who in our audience has actually worn a CGM before. It doesn't have to be through Veri, but I know that we have our little like raised hand. I don't know if there's like other ways that we can have people say if they've done that. I would just love to get a sense of how many folks in our
Yeah, you
audience
guys
have
can just
worn
say
one
like
before.
me or yes. Yeah, my niece has, and it says
Okay.
I definitely have. Actually, I'm excited. Like, I want to share because I did mine, and I forget if I shared this with you, Hannah, when we first talked, but the first time I did a CGM, it was several years ago, and I remember getting an unsweetened oat milk latte. And I saw my CGM afterwards, and I was like, what in the heck just happened? And now, like in the past year, everybody's like talking about oat milk and how it's like crazy and it affects your blood glucose. And I was like, wow, how incredible was that I had that instant biofeedback to be able to monitor, like, holy whoa, like this thing that I just did that I would think had zero impact on my blood sugar. I mean, essentially, like completely spiked it. So it was just such an
Yeah.
incredible like and guess what? I never ordered an oat milk latte again.
Yeah. And
But
I
yeah.
think there's, there's always, I think, light bulb moments for everyone when they wear a CGM. And it's different for everyone too, which is one of the things I love about using a CGM is that it's really giving you the real-time feedback to your body. And most people will have that response to oats in particular, are just very high glycemic, especially if they're highly processed. So steel cut oats is going to be different than oat milk, for example. Same thing with white rice. I think that's one that just shocks a lot of people. They're like, oh, I was having my lean chicken with some rice for dinner. And what happened? And it's that level of polishing on the rice contributes to the high glycemic index. So thank you everyone for jumping in the chat. Sounds like we have a few folks who are familiar with CGMs, but maybe plenty of people who aren't too familiar. So I would love to just start with, what is a CGM? What is glucose? What does this have to do with nutrition, wellness, and healthcare practices, and how can it help you? So let me go ahead and share my screen if that's all right. And we'll
Just
just dive right in.
reminder, yeah, while Hannah's getting ready with her presentation, all questions, please put them in the Q&A, just so we can make sure that we don't miss any of them. So thanks, guys.
Yes, thank you. And ask questions anytime, please. I'm happy to pivot to whatever y'all need. So, all right, I will make this a little bit bigger so hopefully everyone can see it pretty clearly. Let's make this full screen. There we go. All right. So just to give you a little overview of what a CGM is. So we actually don't produce the CGMs ourselves. We use the Abbott Libre CGM. So this is one of the most common standard CGMs on the market today. It is a sensor. It lasts for about 14 days. It's going to sit on top of your skin. I'm actually wearing one right now. So you can see I've got a little sticker over it protecting it, but it's using a medical grade adhesive to stay on my skin. It's totally waterproof. You can swim with it. You can take a shower with it. You can do vigorous workouts, yoga, whatnot, whatever you're doing, you can do it with a CGM on, I guarantee you. It has a very small flexible filament that goes underneath the skin. So it's not a needle. It's a big misconception. You don't have like a live needle stuck in your arm. It's a flexible little filament, goes under your skin, and it's continuously sampling every single minute the interstitial fluid just under the skin. So it's actually not sampling your blood. That's another big misconception. And it's using that interstitial fluid to measure your glucose levels just that are freely circulating in your body. That's happening every single minute, and it lasts 14 days. You're able to scan that with your phone and have this continuous picture of what's going on with your glucose levels. And so this is something that we use as a proxy to understand a whole host of broader health indicators. So again, this is kind of the key to our product, but what we're really building is the software here. So briefly, I'll give you an update on what the glucose monitoring is, and then we'll dive into what we do with that data and how we help that make sense for you and for potentially your patients or clients. So when we address glucose and metabolic health, we really think about it in 4 pillars. So as you were mentioning, Michelle, food is obviously a huge part of that. You're going to see reactions to different foods that you eat. So things that are high glycemic, like white rice or highly processed oats, are typically, for most people, going to create a pretty dramatic glucose response because your body's going to have to release more insulin in order to process that energy and store it. But it's not the whole picture. So we always like to talk about the other four pillars. And these are just sort of general approximations here. Obviously, these percentages are not precise. For different people, exercise may be a larger lever, sleep may be a larger lever, but generally we kind of think about our approach to metabolic health in this way. And so the quality of your sleep, the duration of your sleep actually has a very direct impact on your glucose response. So you might be eating that same breakfast every single day and have a different response one day. And that could be because maybe you went to bed later last night, or, something happened in the middle of the night, you got woken up, your sleep was disturbed. So the quality was poorer. And that can actually really reduce your, what we call insulin. It increases insulin resistance, which is how your body actually processes that glucose. And so you might see a different response to the same exact foods. Same things with stress. A lot of people are very surprised to see that they will get a glucose spike in the middle of the day and they haven't eaten a thing. They're like, what is going on? Why am I having this spike? Well, it's actually your body. It's part of like the adrenaline and cortisol response. Let's say you're in a stressful meeting or something happened out in the world, your body is reacting to that, and it's actually needing to burn glucose as energy as part of that adrenal response. And so you're going to see a glucose spike, even though you didn't eat anything, didn't put anything in your body. You might have just been sitting in your chair. You might not even have been walking, and you can see a glucose response. So it's harder to track stress, but we always like to call out that stress can be kind of the invisible factor in how your body is responding to what you're eating. And then, of course, as we all, I think, know well, exercise and activity, how you're moving in the world, is going to also change your glucose response. So we would try to look at this holistic picture of how can we improve our insulin resistance if that's present. So someone that has prediabetes, let's say, is going to have a lot of insulin resistance, and how can we reduce that and start reversing that? A big piece of that is going to be food. So it might be the timing of the meal. It might be the type of food that's in the meal. It might even be the order that you eat within the meal. Do you have fiber first or do you have fiber after? How much protein is contained in that meal? All of this is going to have an impact on it, but we don't want to lose track of the other pillars as well. So, what we're seeing in that graph in the upper right-hand corner there is a kind of exaggerated example, stylized example here of, the difference of the timing of the eating or the different types of food within a meal, and how you can actually run experiments and see, what is the biggest factor for you or for a particular client. Is it the type of food? Is it the quantity of the food? Is it the timing of the food? Or is it these other things? Is it perhaps sleep? Is it perhaps activity? And so that is how we are addressing metabolic health, by having this continuous monitoring of glucose. So rather than, waiting to measure something like weight, which kind of has been used traditionally, right? We're like, hey, we want to see 5 pounds of weight loss, or we want to see body fat percentage go down, or even calorie counting. It doesn't give us that holistic picture of what might be happening with stress, what might be happening with the activity levels directly. And we're not seeing it necessarily in real time. It takes time to lose weight. Whereas with glucose response, we are seeing that almost immediately, like within minutes after eating something or within minutes after exercising. You're going to understand to be able to see on the app what's happening within your body and how your body is responding to it. So this is a leading indicator, is what we like to call it, rather than a lagging indicator. We have to wait for a weight change. We have to wait to see what a nutrition change or calorie counts even do. Whereas CGMs give us that real-time feedback response, so we can start adjusting and trying different things faster. So that gives us a really powerful opportunity to impact health outcomes. And so this is, there's links at the end of this presentation, by the way. So if you ever want to dive into any of these clinical studies, feel free. These were not clinical studies done with Veri specifically, but done with CGMs in general when it comes to nutrition guidance. And so this is just talking about the impact that it has primarily for the client, for the individual that's participating in this. And what we see is that even amongst healthy population, glucose response differs. So I might drink that same, oat milk latte, Michelle, and I might have a slightly different response. And that's going to maybe have things to do with my genetics, might have to do with my lifestyle. It might have to do with what I ate for dinner last night. There's so many different factors, right? And so what we're seeing through this like broader research on larger populations is that there's no singular guidance that we can provide. We can't just say, here's the magic bullet of how to eat and you're always going to get a good score. Your good score might be, unlocked by sleep, and my good score might be unlocked by nutrition. It just really depends. But the good news is what we see within client populations is that when we're talking about behavior change, which can be so difficult for people, CGMs really increase motivation. It gives them that real-time feedback loop. So they don't have to wait 3 months to see if they lose the weight. They can actually see, oh, wow, my meal score is better. My glucose response is better. And they have this positive feedback loop that helps them stay on track and keep trying these new habits and keep building them. And of course, over time, that compounds and you're going to see better health outcomes when they're able to stick to whatever changes they're trying to make in their life, again, whether it be lifestyle, nutrition, whatnot. And so in this last study, the third one, they actually had nutritionists working directly with clients, and one group of them just had their regular nutrition education and one-on-one sessions. The other one had the same exact education, so same content, same type of format, but they added a CGM. And what they saw was faster and more improvement in their outcomes than the group that was only receiving education. And so again, we see that we're hypothesizing that that's related to that increased motivation. So really helping the client understand for themselves and kind of see that window into their own body of, you know, what happens when I exercise at this time of day? What happens when I eat this type of food? Rather than kind of flying blind, as it were, without it. So I'll take a quick pause there. So that's kind of our quick overview of glucose and metabolic health. Of course, there's so much literature, so much research that's going into this space right now. We could talk for an hour just on metabolic health. But that's our like high overview. Were there any questions that were popping up in the chat about
Yeah,
this? Oh, I see.
There's a quick question. Yeah.
Yeah, is the tape latex free? It is, but it is a medical grade adhesive. So there's no latex in the sticker or in the product itself. But if anyone has a medical adhesive sensitivity, they're pretty rare, but they do happen, then unfortunately CGMs would not be appropriate. You would have to do something like a finger prick monitor, which is just limited in how frequently you can use it. The finger prick monitor is actually sampling blood. That's kind of the old school way of, especially for diabetics. But there's only so many times you can poke your finger and you have to remember to do it. So you're just not going to get as much clarity on the sampling. You're going to just have a few data points rather than a continuous, you know, you're going to see that roller coaster with the CGM.
Exactly. Yeah. And then there's a question about client information. So just using like basically particularly research is conducted without fully understanding the use of the platforms or the consent from the participants. Usually you consent to participate in studies, but with online health tracking industries, your data is used for the platforms to learn and gather info to improve their tech, but how unscrambling or maybe like how encrypted or private is the user information?
I love this question. So thank you for this question. This is something we care about very deeply at Veri. So none of these studies that we just discussed were done using Veri. These were totally separate clinical studies done by a variety of different hospitals and groups across the country using CGM, same CGM we use, but again, not our product. We're actually based in Europe, in Finland. And so Europe has some of the best data privacy regulation in the world, and we are compliant with all of it. So if you've heard of GDPR, we are fully GDPR compliant, which means all of our data is completely anonymized. It used to be so private that actually if you changed iPhones, you would actually lose all your data, which ended up being a really bad experience for some of our folks who had been using the platform long term, and they got a new iPhone and suddenly all their data was gone and they didn't understand why. And we're like, that's because we don't store it or save it. It was on your phone and then you got rid of the phone and now it's gone. We don't have it. So we have improved that. We do have data storage now, but it is under very strict regulations on how we store it, associate it with you, and then again, anonymize it for any other usage. We are not currently doing any clinical studies. We're not doing any research on that data ourselves. If we ever were to do that, it would be an explicit opt-in that users would be invited to. They would have full explicit information on what the study is, what they would be participating in. And again, all of those studies are typically anonymized as well. So I super appreciate that question. But we do a lot on our engineering side to ensure that this is something that is very private. And again, when we are then working in a clinical setting, so we'll share a little bit later our coaching dashboard that practitioners can use. That is all done, within the GDPR regulations. It requires a data sharing request to be sent to your client, and they have to explicitly grant you access to specific types of their data. They can revoke that at any time. So even if you have paid for their, sensors and sent them the sensors, they're not required to share their data with you. That is a separate process, and they do have to explicitly legally share that data with you.
Wow, that's awesome. I didn't realize that. That's great. That's great.
Yeah.
How do you dispose of the CGMs? Do they become biohazard?
Yes. So there's two different methods right now for disposing of CGMs. They are biohazard. So there's a lot of drop-off points within the US that you can typically just like put them in a little plastic baggie, drop them off anywhere that you have a biohazard drop-off. I believe Abbott just started piloting. I believe it's in all of the US. I might have to double check myself on this, but they just started a program for recycling actually. So they you can go online to Abbott's website. They will send you a special like package to put your used sensors in. I think you wait until you have a few of them. And then you mail them back to Abbott, and they will actually process them and recycle them as well. So we don't offer a recycling program right now, but that is direct through Abbott. I'm not sure if it's in Canada right now. Abbott is worldwide, but I'm not sure where their recycling program is currently live. So I would go on Abbott's website and double check that, but that is an option.
Awesome. Super helpful. So good. All right, let's dive deeper.
Yeah, so let's talk a little bit about what Veri does. So that's the CGM, that's kind of glucose monitoring. So what's our approach? So the problem that we see, and probably that most of you are aware of, is that across the globe, we are seeing an increase in prediabetes, metabolic dysfunction, and obesity across the globe. And we've also seen plenty of studies that show that, highly restrictive dieting that are very popular, particularly in the United States, often do not produce long-term results. We see a lot of, rebound weight gain after restrictive eating, and it's not really answering the underlying question. And so our approach is to take as holistic a view as possible of your body and your health and give you that real-time feedback loop. So we're using the Abbott Libre CGM that you're seeing on top there. It's that little CGM sensor. We're also compatible with most activity and fitness trackers on the market. So things like Fitbit, Oura Rings, I'm wearing an Oura Ring right now, Apple Watch, etc. Pretty much anything that's on the market right now, there's the opportunity to pair that again with your account so that you can see all of that in one place. So we're trying to see all four of those pillars of health: your sleep, your activity, your food, and then your stress. Stress is still probably the hardest one to get our finger on. But we can get a pretty good picture of at least those three pillars of food, sleep, and exercise through this kind of pairing of data across the board. And then what we have in our app is the ability to aggregate that and make that meaningful, make it make sense to you, so that you can start experimenting and finding those behavior changes or adjustments that are going to really unlock those long-term health improvements that are going to be maintainable over time. And again, letting those be personalized to the individual and not assuming, anything about them beforehand. So really what we're looking at is, like I said, on this left-hand side here, the inputs. So all those different four pillars, we're trying to pick up on them as clearly and consistently as possible. So ideally through the use of something with a heart rate tracker on it, as well as the CGM that you're wearing. And then we're giving you some outputs. So we're helping you contextualize all that information with our scoring system. And I'll show you what that looks like in just a moment. But we have a meal score, a daily score, and a weekly report. All of those things are helping make sense of this huge feed of data, because otherwise it's just a million data points. And it's like, what are we doing here? So this has been developed alongside a lot of medical experts at various universities across the country that have been weighing in on how we develop these algorithms and how this is delivered to both you and your clients in the app. So essentially, this is what you're going to see, your client would see in the app, and I'll show you in just a moment what it'll look like on a dashboard. But you're seeing that real-time, roller coaster, so to speak, of the glucose levels coming in. You're able to see, when they're logging a meal, when there's an activity like exercise, when their sleep was, and then we're assigning it a score. Our meal score is 1 to 10. And so it's taking that 2-hour postprandial window of how the body reacted to that eating event. So let's say you ate lunch at 12:13. It's going to look at that 2 hours after 12:13 and understand how your body responded, and then give you a score from 1 to 10. So rather than you having to interpret precisely what is this, bumpy line mean, it's helping you understand what that is. And so we're looking at a variety of metrics within that data. We're looking at how quickly the glucose is going to spike, how long it stays elevated, and then how quickly it returns to your kind of baseline rate. And so that is all being contextualized for you in the score. You don't have to be an expert in precise metabolic measures to understand this. Same thing with the daily score. The daily score is 0 to 100, and it's cumulative, and it looks at all of those 4 pillars of health. So it is pulling in your sleep quality and your sleep duration. It's pulling in your activity level, your steps, your heart rate. All of that is coming together with your meal scores, with your glucose scores to understand generally how is today going. And it's not perfect. We're not aiming for 100. We're not aiming for a flat line. We like to joke that if it was a flat line, you would be dead. So there are going to be, spikes. There are going to be lows. There's going to be movement within this, but it's really nice longitudinally. So let's say you're working with a client for, 2 to 3 months. Ideally, maybe when they start, they're getting, 67, 68 in their daily score. And as time goes on, you're seeing that kind of inch up and they're getting into the 80s or into the 90s. And so you're able to see this general improvement over time, again, without having to measure their weight, without having them to, do microcalorie counting or anything like that. You're going to see this kind of gradual change over time. Or if it's going down, then you're like, okay, we can investigate that. Why might these daily scores be trending down versus trending up or stabilizing? So we've seen within our populations, and again, this is a great, going back to our question about anonymized data. So this is completely anonymized. There's anonymized data here, and then a survey that we send out. So this is opt-in. So these are post-use survey results that have gone out to real users. So not everyone participates. So this is not, including our entire user population over the past few years, but many people like to volunteer and tell us how it went. So we've seen, generally between 70 and 80% of people are seeing market improvement in their goals that they came to us with, whether that was weight loss, making maintainable changes to their diet, and then seeing improvement in their glucose levels. So we're really excited to be able to see this over time with some of our long-term users. So any questions before I move on to how this can be used in a clinical practice? I see a couple questions in the chat here.
Yeah. Is it compatible with Garmin Watch?
It is, yes. So essentially anything that can pair with the Apple Health Kit app on your iPhone or the Google Fit app on your Android phone, you can basically give us permissions to read that data. So if you have an iPhone and you're syncing a tracking device like a Garmin to it, you would basically just have to, again, explicitly grant permission for us to be able to see that data. And then we would use that to contextualize your glucose values. We have direct integrations with Polar, Aura, and Fitbit at the moment. And then the rest are coming through Apple Health Kit.
Wow,
and
that's cool that you guys integrate with Aura. That's so cool.
Yeah, we love Aura.
Yeah.
When you apply the CGM, does it immediately begin to give you accurate readings, or is there a calibration period? Good question, Annette. So there is a calibration period. It's an hour long. So we recommend waiting to put the protective sticker on till after that hour is complete, just to make sure everything has gone well. That's something that happens automatically. So you don't have to do anything. There's no user participation. It's just kind of a warm-up period for the sensor. Everything happens automatically. What I will say is that CGMs, again, they're very different than a finger stick monitor. So I like to call out that it is different than a blood draw. So if you're doing like a main blood draw for an A1C value or a finger prick for a blood glucose value, that is different from a CGM. A CGM is sampling interstitial fluid. So even diabetics, before they dose insulin, they're going to do a finger stick just to confirm the value before they actually do their insulin dosage. Why this is relevant is what a CGM is looking at is relative change over time. So it's that roller coaster up and down of what are those relative values. It's doing that for 14 days straight. There is a tolerance that Abbott and all CGM makers stay within, that they legally have to stay within, like this margin of error. But there you can see some minor discrepancies versus a blood glucose test. So if you do a finger prick, it might be a few points up or down versus what you're going to see from the CGM. And that's to be expected because, again, that CGM is not looking for an absolute value. It's looking for the relative value continuously. What is the normal range postprandial with CGMs? Runs higher than the finger stick. Yeah, so finger stick is different, like we just talked about. Postprandial range, basically our normal range that we like to recommend, which is, I think The general range that the WHO also supports is 70 to 140 milligrams per deciliter. With a postprandial, you'll typically see a rise of, probably 20 to 30 milligrams per deciliter. It really depends on the person, though. Again, what we care about is how quickly did it spike and what was the duration of the spike? Did you stay elevated for 2 hours, let's say? That would be concerning. Optimally with an insulin sensitive person that's not pre-diabetic, your body's going to release the right amount of insulin to bring that glucose level back down. You're going to see kind of a hump. It'll look like a little hill. So it'll go up and then it'll just kind of come right back down again. When you have higher insulin resistance, what you tend to see is a very quick, rapid spike. It's going to spike a lot higher. And then oftentimes you're going to see it like stay elevated for a longer period of time. And that's when your body is insulin resistant. It's struggling to release the correct amount of insulin or to use that insulin properly to bring that glucose level back down. So again, it's different person to person, but we care more about kind of the shape of that curve. And that's what that meal score is also interpreting for you on that 0 to 10 scale. Do you have a calibration period each time you replace a CGM? Yes. So each CGM lasts 14 days. You cannot take it on or off. If you take it off, it's done. Cannot be reinserted. And that's just the amount of battery it has in it. So it can live for 14 days and you have to put a new one on. Each one has to calibrate individually. And again, because these are separate sensors, they may go in a slightly different place on your arm or your body. You can see a little bit of difference sensor to sensor, and that is pretty normal for it to be, kind of 5 up or down between sensors. But again, what we care about is that relative, path and the scoring. And so we're able to kind of normalize that over time. So we care less about the exact number that, you clocked in at a 96. We care a lot more about what was the shape of that curve. And is that consistently happening or is it changing over time? Which brand of protective sticker do you recommend? There are so many on the market. There's some great ones, especially for specific sports and things on Amazon. We do not, name drop any of them. So feel free to go and have fun exploring. I've tried a few myself. We do include our own protective stickers that we manufacture with every sensor. You get 2 per sensor. So just in case you need an extra, you got one. But there's a lot on the market. So I just recommend, reading the reviews. Which location on the body offers the most accurate readings? So the one that's recommended by Abbott and most manufacturers is going to be the back of the arm, kind of like I have it right now. So this area for most people has a little bit more give. So you can see it's got a little tissue there, which is really good for it's, not going to be in the way. You're less likely to, hit it on anything. And it's going to be able to sample that interstitial fluid. Anywhere where you have a lot more muscle density, like top of the shoulder up here, you could put it there, but it's going to be harder the insertion is just going to be different. So we always recommend something that's, a little bit, got a little give, a little fleshy. I know that some people place it other places, but we always recommend back of arm, somewhere on the back to the side of the arm. Some people do it like right here where their 2 muscles meet. A lot of men prefer that placement, and then women tend to prefer kind of the full back of the arm. But other than that, we don't recommend any other ones, though you'll probably see diabetics placing it other places as well. Legs would be a bad idea just because it's the risk of getting, pulled off. So that's the main thing for us. Again, the accuracy has more to do with the consistency. Are we able to get a consistent reading for 14 days straight? So we really want the place where it's going to be least disturbed. You're not going to lie on it weird, So if you're like a back sleeper, maybe put it on the side of your arm. If you're a side sleeper, put it on the back of your arm, that sort of thing.
Oh, good. Cool. Great questions, guys. Yeah.
How are we doing on time, Michelle?
We're doing great on time. Yeah, we've got about 25 minutes if we want it, if we need it. So, I mean, wonderful. I know everybody's probably like, wait, so how do I use this in practice? What are some cool creative ways to actually do this?
Yeah, so let's jump to that. I'm happy to talk about that. That's the part that I love because I work with our coaches every day. And coaches is a broad term. It includes our practitioners. Some of them are doctors, some of them are nurse practitioners. So just a very broad term here. But essentially what we've created, we're a software company. So we're creating a suite of tools that help you integrate all of this data into your daily practice with your clients and trying to make it as simple and easy for you to do that. So, I'm about to show you our dashboard, but it allows you to see all those glucose values in real time, any meals that your client is logging, the nutrition value of that meal, if you're having them do detailed meal tracking. I'll show you what that looks like, as well as all the scores we were speaking about and the additional data if they're wearing another tracker. So let me change my tab here. So this is what our dashboard looks like. It is compatible with any client that's using Veri. So you can see their real-time data coming in here. You can zoom in. I can see, the amount of sleep here. I can see the meals that happened and when they happened, and like zoom in on this. This person is not tracking their steps or their activity. They're manually entering their exercise here. So you can see in the evening time, they went for a walk. Whereas if I did have steps, I would actually see them as a bar graph. So I could actually see when that person is walking. We do know that a postprandial walk has a big impact for a lot of folks on their glucose response. So eating a meal and then walking directly afterwards, you'll typically get a different meal score, different glucose response than you would if you just ate that meal and then sat down. So this allows you to see when they're doing that. Again, zoom in, identify kind of like those points on the graph of what was happening. And again, you can see here the different types of roller coaster profiles, right? So all of this is within our target zone of 70 to 140, but you can see the breakfast here had that little spike, but then just came right back down again. The walk probably helped with that. Lunch, this went up and kind of stayed elevated for a little while. Didn't get crazy high, but it did stay elevated. It took a little longer for it to come down. That's also very normal. Insulin resistance increases throughout the day. So you're going to be most insulin sensitive in the morning, typically, least insulin sensitive in the evening. So that's why a lot of times a large dinner or dessert after dinner is going to be, the most difficult for your body to process versus if you ate that earlier in the day. And then you can see here at the dinner time, it increased even more and stayed elevated even longer. It didn't really come back down to our average amount. So if we scroll down to the meals, we'll see that reflected here in those meal scores. So we've got an 8, a 7, and a 6. So you can see those scores kind of decreasing over the course of the day. And really what that's interpreting is those roller coaster profiles here of what that response looked like so that you don't have to do that manually yourself. We also pull out a lot of different data for you to see here, and we do label it. So we're going to look at the glucose variability. This really helps us see, how all over the map is this person. So this is, we are getting a very high kind of warning sign here, but this is really something we should look at. How much of the day did they spend in that target range of 70 to 140? This person did a pretty good job, but we can see in the evening time, something really happened, and I'm wondering if there was a dinner here that didn't get logged because I'm seeing breakfast, lunch, and the workout, but seems like maybe they ate something here. So this would be something where when I have a meeting with this client, I would ask them, I would say, hey, what was going on this day? Did you eat a late dinner? Was it a large dinner? I don't see anything here, but clearly there was a response that happened. And then we also see their intermittent fasting time, which helps us understand how the body is processing overnight. And so we've got a few things that they are doing really well. We can see their sleep overall is doing great. Their intermittent fasting is doing great. But they are having, some issues with this glucose variability, and their average glucose is on the high side. So, they're going kind of from a fairly low 77, like basically 80 seems to be their baseline, but then they're frequently going outside of their range after meals. So we could start opening these meals and seeing what's in them. So we can look at this breakfast and see, based on the portions and the ingredients that they logged, what the nutritional information of that was. We can dig in and discuss that with them. We can also see over time if they're eating that consistently, are they getting different scores? What might have had a positive or negative influence on a score for a recurring meal? So let's say they eat the same breakfast every day. We can try different things to see what will increase that score and improve it over time. And then finally, what we can do is start looking longitudinally at this person. So we can look at a 7-day view or even a 30-day view. We call this the ambulatory glucose graph, very commonly used for diabetics, but we're starting to use it for other purposes here. And what this allows us to do is see 7 days of data mapped on top of each other. So we can start seeing that this person has difficulty, and this person is me, has difficulty with dinner time. So you can see I typically have a pretty even response to my breakfast and lunch, some departures here on some of the days, but generally this is a pretty, even keeled response. But dinner times are going right to the top of the range, and there's having a lot of variability within that. So if I was my client, I would be like, let's talk about dinner time. What's going on with dinner? Are we eating too late in the evening? Is the timing of exercise just not working for you? Is there something we can do to, ideally bring this down just a little bit and see if that improves? And that's also reflected when we look at the details. So we see that the glucose variability over here is a bit high and my meal score is low. So most likely for me, this is nutrition related because my exercise and sleep seems to be doing quite well. And so this may be more of a nutrition oriented thing. Whereas for other folks, you might be seeing sleep being highlighted as something that's a problem area, or exercise might be low. So there's, all those different levers that you can use to tune. And then when we're looking at a week, we can look at what was the best meals, what were the worst meals. We can dive into them and start seeing what the details were. And so you can kind of see how over time this will allow you to have that, feedback loop to start adjusting and tailoring that protocol for this individual to hopefully see improvements for them. I will pause there. It looks like we have quite a few questions. Annette says, would you place this on your non-dominant arm? You can do either one. I typically put my non-dominant arm, but if it's on the back of the arm, it really doesn't tend to matter. So really whichever one you're comfortable with. Some people like to swap it back and forth with each sensor if they're wearing multiple. Can a patient share this info with their practitioner? Yes, so that's what this dashboard is all about. So like I mentioned earlier in the call, this requires that the individual grants access to share their data with you. So you actually have to you have to share a data pairing request with the individual, and it'll pop up in their Veri app and say, this person with this email address would like to view this, and this data, accept or deny. If they accept it, then you'll be able to see it on the dashboard, but that client can revoke that access at any time. You can also end the relationship as well and delete them off your dashboard. But, typically it's, we let the client be in the driver's seat there. For people with type 1 diabetes, can they input insulin dose? So this product has not been tested on diabetes. We're only compatible with non-diabetics right now. I know that probably there are people with type 1 in particular that are, very eager to use something like this, but the testing that we did on all of our algorithms was done in partnership with a healthy population. So we just cannot, that scoring system for meals, daily scores, et cetera, was not tested in, diabetic scenarios. And we do know that, the profile of a diabetic person, the response that they're going to have is going to differ quite dramatically from, a healthy person. Now, there's a whole spectrum of healthy. So within healthy, there's still, varying levels of insulin resistance, varying levals of diabetic state. So we do have a lot of pre-diabetics that use this product, but unfortunately we do not have anything around, this is not a medical device. We're not doing anything with insulin, unfortunately. For the coaches you work with, what is the training and support like? Great question, Elise. So we do have weekly sessions for our coaches. So we do like a live Q&A every week. Once a month, we do training sessions. We do bring in some of our internal research and practitioner developers with us. So we'll have sometimes a nutritionist, sometimes a medical doctor, whoever is actively working on a new feature to come speak about it and help educate. And then we do have a library of resources that, we're referencing and using that you're of course welcome to reference and use as well. How do you suggest patients start with CGM in terms of modifying their diet and lifestyle habits? Love this question. So obviously, we have a lot of folks that come to us just directly. So our initial product for the first 3 years of our company was a consumer product. We still have a very large consumer base. So people just come and they're doing it DIY. So within the app, they're measuring and tracking their own meals. They're looking at their meal scores and trying to interpret it themselves. We do have some guidance in the app for those consumers if they aren't working with a coach. But we really love working with practitioners because we believe that's just a stronger way to start and a healthier way to start. There's less, possibility to have misinterpretations of the data. So I would encourage you to, look at that data and help them interpret it with all of the knowledge and expertise that you're bringing to the table. We have a lot of different practitioners with different expertise that serve different niches. So they really know their clients best on a human level. And like we mentioned at the beginning with the 4 pillars, that stress pillar, it's really hard to detect, in an app. That's something that can come up in a one-to-one conversation when you're working with a client and what they're facing in their life, their context better than anyone. And you can know, is it time to really pay attention to nutrition, or is there other interventions or other behavior changes that would be more appropriate for this individual? So I know that's kind of a non-answer, but it's really individualized. I would recommend, just starting getting a baseline, using the first sensor to really see where are they at, what's happening naturally occurring in their body. And then, going from there and seeing what adjustments you want to experiment with. And then again, have that real-time feedback to see how that is impacting them. How do you find alcohol impacts blood sugar? Great question. Again, depends on the alcohol, especially mixed drinks. You are going to see typically a spike. There's a lot of hidden sugar in a lot of drinks, especially cocktails. Sometimes they put so much sugar in that stuff, and it's just high fructose corn syrup or just cane sugar. And so you will see a big spike just from it's glucose or sucrose that's in it. Other drinks like beer, high carb, so you will typically see some kind of response. There are some studies, I believe we have them posted somewhere. If not, I'll try to find them. There's certain alcohol that temporarily slightly lowers glucose values. So sometimes you see this weird sort of like double hump where it'll decrease a little bit and then it'll spike. So it's kind of a delayed response, especially with things like red wine. But again, differs for different people. Depends on the context. Did you eat before or after? Did you work out that day? Did you get a lot of sun that day? Did you sleep well? It's going to really depend on the drink and the context. Prediabetes. Have you helped people discover this statistics? So yes, we have. We do not currently, we don't diagnose anything. This is not a medical app, but a lot of people, if they're consistently getting low meal scores, they're getting high variability, all of that stuff, that's indicative typically of a lot of insulin resistance. And that person, we will typically recommend, speak to their practitioner, perhaps request an A1C test to see. That A1C test is going to look at 3 months of data in their body, and that's what's currently used for diagnosis of pre-diabetic state and diabetes. So we don't diagnose, we don't do any of that automatically, but we can get leading indicators of that. And does the app give suggestions for modifications? So yes and no. So for our consumer product, we do have what we call Journey. So it gives them kind of, additional education resources, helping them understand everything we're talking about right now. What is glucose? What is insulin resistance? What are the pillars of health? How can you, what are your levers that you can play with here? For our, B2B product, when we have clients working with a clinician, we are not interfering in that client-clinician relationship. So it's really up to you to design your own protocol around that, and use these tools, the app, the dashboard, with the individual, and then give them guidance, as you typically would previously.
Amazing.
Wonderful questions.
I have a couple questions that I can add or ask that are hopefully helpful for people. So how are you seeing practitioners using this, like more one-on-one, group? Are people including it in like programs or packages? Are they sending their clients to Veri to purchase? How does it all work? Like the logistics?
Yes. So there's a whole variety. So we really have built this to be as flexible and kind of a toolkit for practitioners. So we have a blend. We have some practitioners that are, very small, independent nutritionists. They're working one-on-one very intimately with their clients. They're meeting with them, perhaps weekly or even more frequently via Zoom, texting, the client. So they're really keeping tabs on this dashboard to see the data come back in real time. And then we have others that are doing really large, kind of like Facebook group style, 30-day resets and things like that. And so they are using it in a very different manner. So we're, really open-ended on how you want to use this. And we're happy to meet with you to help you understand how you might use it. That's also what our live sessions are for weekly. Our pricing is priced in such a way that it is flexible. So essentially there's 2 different ways that you can use this. You can have your client pay for it themselves. So they can get our, standard Veri membership, comes with 2 sensors and the app access. That's currently quarterly. So they get 3 months of app access and 2 sensors by default. They want to add more sensors on. These are at cost, so we're not adding any margin to the sensors. This is truly our cost to get it to their doorstep. So they can get one for $90 or two for $160. We're handling all the prescription and fulfillment flow there. Or they can get an app-only membership. So some folks are bringing their own sensors. They might be getting it through their local pharmacy. They might have a prescription for it already. In that case, you just need the software layer. So we do have that option. Or if you want to have this completely bundled and integrated into your protocol or your program, you can actually pay on their behalf. So you can choose how many sensors you want to use. Again, it's the same at-cost pricing, and then you get them all set up. So essentially what that would look like, bundled, you can just hide that cost. So you'd pay $217 to set up a client with the 2 sensors and the app access. That could be passed on and factored into your own pricing. So if you're selling a 3-month program, that's just a cost that you're hiding in that, and you can mark it up. So, maybe you add $300 to your overall program price in order to include 2 sensors of Veri during that 3-month program, for example. The other options that some of our clinicians prefer to do is to have the client paying for all their sensors and getting it direct through us. If they're doing that, then the client's going to pay either $297 upfront or $109 per month. We do have monthly payment options for the set with sensors, or they're going to pay $39 a month for just the app access. And then the clinician is only paying for the dashboard, which is $6 a month. So this is kind of the, choose your own adventure way of doing it. I know it's a lot to take in right now, so I wanted to just breeze over it and touch on it. But I know that a lot of people are probably wondering practically, how could I do this in my own practice? And, the answer is really, it's up to you and what you would prefer. Do you want to give a link to your client and have them, procure it themselves and be, paying for it that individually? Or do you want to sell kind of an all-inclusive program that already has the sensors baked in, and your client doesn't have to do any separate purchase, doesn't have to go anywhere, like they're just going to get it and you can do that purely on their behalf. The client doesn't have to place an order, they don't have to do anything. They would just get the sensors, essentially drop ship. We would ship it directly to the client, but we would ship it on your behalf.
So cool. I love the flexibility. Yeah, that's so cool. I love it. That's awesome. We have a few more questions. If you want to dive in, we've got about 8 minutes, so I'll let you dive into those, Hana.
I bet we can get through these. I think we can do it. Keep the questions coming. How to pay, HSA, insurance, private pay. So currently we are looking into FSA, HSA, compliance by default. Right now you can submit an invoice. We will make sure that if you are the billed party, you will get the full invoice, of course, for tax purposes. And then it can also be used for FSA, HSA. Same thing for the, consumer plan. If the client is paying for it themselves, they can also submit it to insurance for coverage. We've seen that for most folks, it is covered. So typically their insurance will see this as a qualified, purchase and reimburse. But it's not something we do automatically right now. So essentially it's private pay with, of course, the option to reimburse. But we're working on making that a smoother path. If a patient is starting with a month of CGM, do you suggest eating as usual the first 2 weeks and then making adaptations the second 2 weeks? Generally, yes. I think, as you start implementing this with your clients, that may vary slightly client to client. So there may be a scenario where something different is appropriate, especially, with someone that has maybe a history of disordered eating. Maybe you're getting to know them a little bit longer before introducing the CGM. If you're using the CGM with someone that does have a history of disordered eating, I typically recommend that you do not have them log as many details. So not logging the portion sizes or ingredients or any of the macro micronutrients. They're not seeing calories. All we need to know is just that they ate at a certain timestamp, and then you'll be able to probably contextualize that a bit for them without having sort of the caloric information or any of that hyperfixation. But generally, yes, we say at least a week, if not 2 weeks of, kind of typical use where you just kind of have a before and after. And then if you're using it more frequently, a lot of people like to do it as a benchmark style. So they might do, one sensor for 2 weeks, wait a few weeks, do another sensor, wait a few weeks, do another sensor. That way you're able to actually implement the behavior changes and kind of practice them. And then you do another check-in and it becomes more like a checkpoint. So you can use it continuously. You can use it intermittently. That's really, up to you. But we do recommend getting a baseline for most folks if it's appropriate. And what is the dashboard seat? Thank you for the question. So the dashboard seat is how you're paying for the dashboard software. So there's the app that we were showing earlier that your client is going to use to log their meals, to scan their sensor, to just have their entire profile there. In order for you to access their information, obviously we've got the data privacy stuff we talked about earlier, but your account, your access to the dashboard and usage of the dashboard is that $6 a month. So it's $6 per client per month.
Amazing. We got through all the questions with 5 minutes to spare. If you guys have any additional questions, now is your time. Pop them in the Q&A. And Kara just dropped Hana's gift, which is $30 off 1/4 of Veri membership. So there is a coupon code there for you guys. Oh, cool. And we've got Hana's notes from the presentation as well. Thanks for supplying those. Appreciate that.
Yeah.
That was amazing. So cool. Like CGMs are such amazing tools, and I love the immediacy, like the immediate biofeedback of just like, oh, that's what's happening. I think like you were saying, it's just like that's so powerful when it comes to habit change, like real life, like habit change. It's so cool. Yeah, Carrie says so cool or very cool. Thank you, Hana. Amazing.
Yeah, thank you so much for hosting, Michelle. Like this has been so exciting to be a part of. Like I said, I have the pleasure of, talking with different practitioners that are doing virtual things almost every day right now. And it's just really neat to see how everyone is figuring this out and creating really welcoming, powerful spaces online. It's not always the simplest thing to do. So like kudos to all of you out there, figuring this out and how to do it. And we're just one tool amongst many. So, and we're always looking to, we're right on the front lines with you in this like Wild West. So, this is something that's actively growing and changing. We're adding new features to our platform all the time. We're working really closely with our practitioners, to get their feedback and what could be better, what could be different. So, we are so grateful to all the practitioners that have been with us thus far, and, that will be with us in the future because it'll just keep continuing to improve and grow what we do. So if you have any questions, feel free to reach out. The slides that I shared have the contact info for myself and then also for our internal nutrition and research lead. So feel free to reach out to either of us, Hana@Veri.co, Emily@Veri.co. We've got more information for you on the website on our custom landing page for you. So it's just Veri.co/BYOP. Really easy to remember. That's got the discount link in there for you too if you want to try Veri for yourself. Always recommend that folks give it a go for themselves before introducing it to clients. You'll probably be surprised by what you find out too. I know I was the first time I used one.
Sure,
but yeah, it's been really wonderful. Thank you for all the detailed questions as well.
Yeah, thank you so much for your time. Susan says, so happy to get this info. Some of my clinic clients were using it and I did not have the info. So good. She says, it seems very valuable giving folks direct feedback. Exactly. Putting it into context makes all the difference. Thank you. Thank you. Have a beautiful rest of your evening. And I'm sure we'll be in touch. See you.
Thanks, everyone. Have a wonderful afternoon.
All right, that's a wrap for today. If you want the exact breakdown of how I help practitioners go from their first 5K to consistent 50K months with just 2 offers, 10 hours per week, and an audience of less than 500 people, be sure to click the link in the podcast description or head to wealthywoman.co/breakdown. To make sure you don't miss an episode, be sure to subscribe. And for daily online practice insights, follow me on Instagram at wealthywoman.co. Let's create your life of wealth, full of abundance, purpose, health, wealth, and joy.